Hi everyone, Dr. Nemechek here. I want to go over how a skin condition called rosacea, which can be rather intense, and it tends to cover the forehead, the nasolabial folds, down around the mouth, but it can actually go across the whole face, has a dramatic response to the treatment of SIBO, or Small Intestinal Bacterial Overgrowth. So, for all of you who've never heard SIBO before, so basically, here's my simplified outline of the intestinal tract. You got stomach, flows into the small intestine, into the large intestine. Now, these families of bacteria predominantly live in the small intestine. These families predominantly live in the large intestine, so I just refer to them as birds and fish. The ratio here is well represented in this graphic. For every one bird bacteria, so to speak, in the small intestine, you have 100 million down here. So this would be solid purple, okay? This is normal setup. And SIBO is this. SIBO is when you have normal bacteria, so not foreign bacteria like you got from tainted food or something, but normal bacteria just in the wrong place. And out of the roughly 1,000 species you have here, it's typically just one growing up there. And this is a very, very common cause of leaky gut and can cause like this IL-1, IL-6, TNF. These are some of the major inflammatory cytokines that can be released into the bloodstream. All right. So that's what SIBO is. And we've known about SIBO for almost 60 years. And we use a very common antibiotic called rifaximin. And what rifaximin does is rifaximin only kills fish in the small intestine. It doesn't kill the birds, and so it will revert you back to this. Also, rifaximin doesn't get in the bloodstream. It won't interact with any other medicines, and because it doesn't get in the bloodstream, you have very, very few side effects. And so what they did in this study, let's see, what's the date on here? Yeah, so this is 2008, okay, which I find a little shocking that we don't have more follow-up on this. But what they did was they took here 113 rosacea patients who came into their facility or clinic, and they were tested for SIBO, and those who were positive, okay, and they did breath tests for SIBO, they received 1,200 milligrams a day of rifaximin. So these would be 600 milligrams twice a day or 400 milligrams 3 times a day, be one of those two regimens. In the US, we have 550 milligram tablets, which works just as well. And or they got placebo. Now, the ones who were treated with rifaximin, you had reversal, just remission in 20 of 28 patients who had rosacea and a positive breath test, and that's about 72%. And then if you throw in another 6 who had greatly improved, you're up at 90%. So 90% of the people with rosacea and SIBO improved with just a 10-day course of rifaximin. Okay, and then they looked at the placebo patients. They were subsequently given the real stuff, rifaximin, and I didn't highlight it, but 15 had complete resolution, meaning that 75% were in remission. Pretty high response to all of these. There's another study showing that after the same treatment regimen, they'll maintain the remission for, I think only it was about 5% relapsed after within 3 years. So it was pretty low. Here's just a picture of some of the people from the study, and you can see here the redness, forehead, the cheeks, completely eradicated. This very intense rosacea here. Look, pretty close. I don't know, just a tiny bit of redness here in the cheeks. And this gentleman also a lot of scaling, so forth. And here, complete remission, just with 10 days of rifaximin. So, I'll have the reference for this in the discussion section. You might want to print it off, take it to your dermatologist if you're struggling with rosacea, and see if they'll give you some rifaximin. That's all for today, everybody. Have a nice afternoon.